Today I will tell you about uncover test. This test is used to detect heterophoria. Phoria is defined as a latent deviation of the eye or the ability of eye to deviate when fusion is blocked. So in this test we basically block the fusion of the patient. To perform this test you need an occluder and a target. Steps of this test are as follows. First of all, ask the patient to fixate at a target. Then cover one eye, remove cover after 3 seconds, and then note the movement of eye under the cover. Let's take this example. If you cover the left eye of the patient, then you have to observe the movement of the left eye after removing the cover. And if you see an inward movement to take fixation, it is termed as exophoria. If you see an outward movement, esophoria, an upward movement, hypophoria, and a downward movement as hyperphoria. And if you see no movement, it indicates orthophoria.